Thank you very much for joining us and staying with us as well. If you just joined us, just gone by was the news review segment where we got to share with the world what our guests thought about the issues making headlines, especially here in Africa, for that matter, Ghana, our beloved country. Let's now go to the consulting room, the mobile consulting room, the extended consulting room, the consulting room annex of the bank hospital, even as Dr. Wisdom Effiong joins us for this particular session. This is Ask the Doctor. So what you need to do is to call us now and begin to ask him whatever question it is, except for anointing oil. Even that one, I understand that he's a prophet, and so he gets into those things. He gets into those areas as well. Welcome indeed. Thank you very much for your time. Yes. So as we wait for your calls, let me start off with mine. I have realized that, I don't know if it's age. I don't know how old I am right now, but I feel old, brother. Yeah, I tell you, bro. And I'm very afraid now. So a lot of things has to change. I'm saying this because the things I didn't used to pick up those days. Look, those days I could stay amongst a lot of people who had called, go repeat, but I would not pick it. These days I could just come close. No, it's Bluetooth to me. There are quite a number of things that I feel. My allergy things are up high and all of that. And somebody tells me that it has to do with my immune system, that it's getting weak. And I'm like, so when you are growing, instead of growing like a fine wine, the immune system is going down. So I want to understand what this whole thing is about, this immune system, and whether or not it becomes weak with age and all of that. Yeah. So tell me about it.
Yes, it's a very good question, because a lot of people, I mean, it's an unseen part of the body.
Right.
So you tend not to pay attention to it. It's not like maybe your head or your arm or your feet or something. So it's more or less like an unseen part of the body. So people really don't, pay more attention to it. Just to chip a little bit in concerning you say you feel you grow. I told you the last time that I think I was telling Biadela that someone texted me that he's 18, but he feels like he has a waist of a 60-year. The waist of a 60-year-old. It's suffering.
It's suffering with waist problem. Brother, I pray for you in Jesus' name.
So the immune system, when we are born, we are born with what we call the innate immune system.
Okay.
Right. We also have something as we grow and develop. We develop what we call the adaptive immune system. So these components work together to ensure that we have a good life, as we grow.
Okay.
And there are basic lifestyle measures that we can take to ensure that we are keeping our immune system in check. I mean, basic thing that we do every day, but some people don't pay attention to it. Something as simple as drinking water.
Oh, I see. That can boost immune system.
Yeah, drinking water. So you can realize that you can be here for 3, 4, 5 hours without getting a liter of water. You see? So something very subtle as drinking water can help. And it's recommended that we take at least 3 liters a day.
Liters is what?
3 liters. So if you're taking the bottle, the 500 mils, that'll be about 6 of it.
So there's small, there's medium, there's large.
Yes.
Which one are you talking about?
So the small, how many mils? I know the 500 mils.
Okay.
I know the 1 liter.
Okay.
Right. So the small one.
Okay.
Yes.
Okay.
Or if you want to compare with sachet water, sachet is 500 mils.
Oh, okay.
Yeah. So about
you
6
take
sachet water.
6 sachet water.
In 24.
See the ml, no, it doesn't work with some of us like that. So just use this one to correct.
Yeah. So about 6 of that, is what is recommended daily.
Hey.
And I'm back to keeping you going. Frequent exercise as well. To keep your blood flowing, your heart beating, cardio.
I thought the frequent exercise is for rich people, so I see them always walking around. As for the poor people, we are always on the
you see, they are rich, so they understand that their health matters, so else their wealth will be useless.
In the air.
You see? What is wealth if you don't have health? You see, it's totally useless. So
Because we think that always we are on the go.
yeah,
Some of us
so it's
we
like you're
walk,
always
I can walk from here to the mall. Then I'll do trot walk, then I'll get down again.
That counts as well, you know, especially sometimes doctors, you know, sometimes tend to, if you actually work in a facility, in my facility, I don't use the elevator.
Okay.
I use the stairs.
Okay.
Yeah, so if I have to go to the 4th floor, you know, the 2nd floor, 3rd floor, I have to go back up, I always use the stairs.
Oh, I see.
I let the patients use the elevators because, I mean, of course, they need the comfort. I don't need that comfort.
So you have to exercise.
Yes.
Okay.
Yeah. So even if you're not conscious about, you know, you don't have time to do that exercise maybe after work, but in the course of your activities, like you said, maybe going to work and all that counts, you know. So some of us, we are intentional because we spend 12 hours, 24 hours in a hospital. You might not have that luxury of time to get home and have some 30 minutes. If you do, great.
Okay.
But if you don't, utilize the minimal opportunities you have by, you know, walking up the stairs, back down. Sometimes I go up and I'm panting, but I feel like it's good for me. It keeps your blood flowing, you know.
Cardio as well.
Yeah.
Okay.
So that is good sleep. Good sleep, you know. About 7.
Also, as for that one, if I get, if I get the sleep, I don't chilly at all.
You don't?
I don't chilly cry. I do so good sleep.
Good sleep.
What's good sleep like?
Sleep.
Because is it 7 hours?
So
is it 8 hours. What's good sleep?
So I think it depends on the age.
Okay.
Right. So growing up, children need more sleep. Like about 12 hours, good 12 hours sleep.
Children?
Yeah, they need good 12 hours of sleep. Babies, all they do is sleep, eat. Play.
Yes.
Sleep, eat, play. They don't have work. They don't have anything to do.
I should have stayed that way. What am I doing like this? What's the need for me like this? What is the country benefiting from me like this?
I don't know.
Hey, when I could just have stayed as a child. Oh, bro. I see. So they do what it is.
Yeah.
So when you're growing to, let's look at.
Yeah, so teens might need about 8 to 10 hours of sleep. You know, then adults need about, you know, 7 to 9.
Okay.
About that 7 hours to 9 hours of sleep.
What if it's more? So people who sleep more, so you are sleeping to 12 hours. People do that too, no? That's bad. That's also bad, right?
So now, too much of everything is not good.
Yes,
so
I get it.
As much as we say don't, you know, try to sleep.
Yeah.
You don't want to oversleep.
Yeah. I see.
It's even a medical condition.
Let's say because I wake up very early to come to work, I don't get enough. So I do omnibus on weekend. So if I don't have any place to go, I sleep the whole of Saturday.
Oh, I mean that's not bad because really you can't cheat the body.
Right.
That one is not you sleeping. Your body forces you to sleep.
Okay.
Sometimes, for instance, sometimes I go for all night.
Yes.
And I come back. Maybe I have to join an online meeting in the morning. That might span till 12 noon. Halfway through the meeting, I'm dozing off.
Right.
You know. So because you have been up all night, and it's not like you've been up all night just maybe seated and all that. You know, you go for your regular all night. You want to jump. You want to
sing,
dance.
Yes.
So you've really activated some form of exercise, and after exercise, the body needs sleep.
Right.
You see, so you tend to sleep. By the time you wake up, it's 7 p.m.
So drink water, more water, exercise.
Yeah. Good sleep.
Good sleep.
Yeah.
Right. So those are very natural ways of doing.
Yeah. Even staying away from stress.
Okay.
Yeah. Certain stress. Thinking about stress.
Yeah.
A lot of people think that maybe when you do rigorous activity, having to realize that sometimes even when you are learning in medical school, we can sit down and even till date, we can sit down and learn for 12 hours and you are tired just by sitting.
Excuse me, what are you learning actually?
Brain power.
What are you learning?
Of course, you take breaks, but you'll be tired.
Okay.
Trust me.
Right.
So people think that except maybe you are lifting blocks, that's the only thing that gives you stress. But you can sit down straight 4 hours learning. Your brain has consumed a lot of glucose, you know, so it makes you so tired. So stress, if you are thinking about so many things, how would I pay school fees? How would I do this? Marital relationships, gives you stress. And when you are stressed, it's not good for the immune system as well.
If they were to catch a lot of Africans down to diagnose the but of course, there are quite a number of things people have also said before we talk about signs of weak immune system. You can also call us. The doctor is here. Ask your daughter about anything. Call us. The issue of people using, how do they call it, supplements to, I don't know what the supplementing though, so to boost immune system. But I'll come to that. Let's do Na Jele from Amra here. Na Jele, if you can hear me, the doctor is here. Good morning and welcome.
Good morning, and thank you for. Good morning, Doc.
Good morning.
Okay, so please, I wanted to ask, the other time that we were doing the back pain, the pain at the back, that this pain at the lower back is normally getting close to my waist. So I wanted to ask, because that day we were talking about the one that also comes with the kidney and all that. So how do you differentiate that pain from normal back pain, or is it related to the kidney, the lower back that I experienced?
Okay.
Do you understand? Do you want to ask her first?
So I think she's asking, how do you differentiate a kidney-related back pain from maybe a musculoskeletal normal back pain from the
Is that it?
Yes.
Yeah, okay.
Yes.
Okay, great.
Yes. And then please, my second question.
Please do.
If you are the type that you normally report a low BP, anytime they check your BP is this low, please, how are you going to handle that assessment? Thank you.
All righty. Thank you very much, Najeli. You can also call us. Let's know what your problems or challenges are or misconceptions to clarify them.
Great. So let me start from her first question. So back pain related to the kidneys, it depends on what exactly is wrong with the kidney. You could have a kidney stone, can give you, loin to groin pain. Technically, that's what it's called, loin to groin pain. But then again, it could be referred to the back. Now, you could have a kidney infection, then that would give you a classic back pain, right? So we want to know exactly what is wrong. Now, if it's a kidney infection, it will come with other symptoms like fever. You feel very warm, vomiting, and all that. You feel general lethargy, you are weak generally. So that will come like with signs of infection, right? And if it's as a result of a stone, kidney stone, you realize that the pain will be colicky. So in a sense that it's not always there. So it comes very sharp, then it goes. So you have moments where you are pain-free, and it comes again very sharp, and then it goes. So those are the kind of, pain you should be expecting if it's a kidney stone. So if you're having intermittent pain, and comes and goes, you're thinking of something like that. As opposed to a classic back pain, musculoskeletal, muscles, bones, ligaments, what we spoke about the last time, where you'd have more or less like a dull pain that is constant, it's always there throughout the day. You are seated, it's there. You are standing, it's there. Sometimes you get relieved if maybe you tend to do some minor exercises. When you sit for a long time, it comes back again, very dull, constant, always there. So that's how you differentiate it. But then again, I'd always advise her to go to the hospital to get checked.
I see.
Because the physicians, the eye sees what the mind knows. Will see better and know better.
Indeed.
Right. So for her second question, she was asking about...
low blood.
Yeah. So now every individual... there's a normal blood pressure that every individual. I mean, of course, when we are advocating for checking your BP and all that, we always say 120/80 as a normal. But truth be told, every individual with their specific BP range, based on your weight. So you would not expect a 40-year-old man who is 120 kg to have the same BP as a 40-year-old man who is 45 kg. You would not expect that. Do you understand? So if you are having at the back of your mind 120 and you check yours is 90, 50, but then again, if you check, the extremes are dangerous. So if it's high, it's bad. You're looking at going to the hypertensive range. If it's low, it's even more deadly as compared to the high, because you're looking at hypotensive, and with that, you could even collapse, really, if it's, So, but then again, that's why we always advocate that people should go for regular checkup. Let us know you when you are healthy. So So when we know you when you're healthy, if you come sick, we should be able to tell that, no, based on your vitals when you were healthy, this is a misnomer, right? But if we don't know you when you are healthy, we don't have records of you when you are healthy, when you are sick, and you come in with a BP of 90, 50, someone will be thinking you are hypotensive. But perhaps that is your normal range. There are some people that live on 98, 60, and that is their normal range. With those kind of people, I would not be in a hurry to correct their BP.
I see.
To give them fluids or anything. I would not be in a hurry because that is your norm.
Okay.
So if we don't know your norm, it will be difficult to differ. So we'll just treat blindly that, okay, this is wrong. Let's just try and correct it. Right? If you realize that maybe the person stays in the hospital day 1, 2, 3, but you realize that is the person's norm, then we are no more alarmed. Or we look at the weight of the person. So an 80-year-old who is like 40 kg having a low BP, I'm not alarmed.
Okay.
You see, but 150 kg man who is having 90, 50, please, you are hypotensive.
Very interesting, very, very interesting. You can also call us. Let's know what your challenges are, again, what your thoughts are about issues surrounding you or your family. I was talking about supplements. You say take supplements to boost your immune system.
Yes. So a lot of people tend to take over-the-counter supplements, which really you cannot force them not to do because, taking their health into their own hands. But I think that there are certain, like I mentioned, too much of everything is not good. So now how do you know your range? Now it depends on the supplement you are taking. There are certain prescribed supplements that you take. For instance, women who are preparing to get pregnant, for some of them, we tend to say, be on folic acid for a while before you become pregnant. That would help, with neural tube defects and all that, any pregnancy issues. So for those kinds, it's prescribed, recommended for a long period. Some people will come with some acute viral infections. We tend to put them on vitamin C, for some other people, they tend to take vitamin C the whole of their lives, and they don't regulate the amount that they take, because now this will become too much, right? It's a medication. In as much as it's sweet, it's a medication. Right. Do you get it? Oxygen, in as much as gives you, makes you breathe well, it's a medication. Right. And you can get intoxicated by taking oxygen, you see. So people don't realize that in as much as something is sweet does not mean that you take it and abuse it, right? So vitamin C is good, but how much are you taking? How long are you taking it for? Do you understand? If it's something you need to take for the rest of your life, your doctor should be aware. Okay. And should even be the one to prescribe that for you. There are certain medications that people are supposed to take for the rest of their lives, So yes, those should be regulated. And you don't want to take more than a certain required daily amount. Some people take vitamin C, the effervescent one. I don't know if you've seen that bottle that you dissolve.
Yeah.
Some people can even take up to 10 a day. Think that, it's vitamin C. One bottle, they'll slot it in like an ATM card, and then they drink.
Don't tell me they're adding it to bread or anything like that as well.
And then they slot it in. So when they think that they need a drink, they slot it in. By then realize a day you are thinking about 10 grams of vitamin C.
Oh, bro.
Imagine doing that for a week.
No.
That's crazy.
We beg. Abba. What? Maybe because they were told that you've got to just live on vitamin C, is good for you, and so let it replace every other thing. Instead of taking alcohol or the soft drinks that come with their challenges, just live on that. But come on, 10?
Yeah, people, you'll be surprised. 10? People do that.
Wow. Anyway, let's look at the signs of a weak immune system. Now I want to know probably what I am feeling could be. So let us know.
So, if your immune system is weak, it tends to give you signals. Okay. And basically would be out of the normal function of the immune system. Okay. Right? Because the normal function is to keep you healthy. Okay. So once you realize that you are not fine, you know that there's something wrong. Maybe all of a sudden some general body weakness, maybe you've been working back to back, you're not getting time to recuperate, you're not having that time to recover, then that you should be worried that there's something wrong, right?
Biadela, you have a missed call.
Anyways, Biadela, you've been missed. So please hurry up and come back.
Pick up the call.
So working back to back without, getting back on the stand. And you realize that you'll be prone to more infections, so viral infections. You're having a cold, you're always picking up a cold. You're recovering from one, you're picking up another one. Recovering from one, you're picking up another one. Common cold, you're having symptoms of maybe bowel, problems, maybe constipation, diarrhea, you're always running every morning, afternoon, so these are signs, subtle signs that you need.
Please hold there. Let's pick this call. Charity is calling us from Soto. Charity, if you can hear us, good morning.
I want to ask the doctor.
Right.
Doc, please. Sorry. I'm an asthmatic patient, and I don't normally check up because I have my inhaler, my salbutamol tablet, and the penicillium. So please ask doctor, is it not to be going for checkup since I know my drugs that I'm supposed to take was triggered it? Is it advisable that I should visit my doctor or I should since I know my drug?
I see.
Is it advisable? Yeah.
All right. Okay. So the condition is that she's asthmatic.
Okay.
And she knows the drugs to take.
Okay.
But she wants to know whether or not, as much as she's got knowledge of it, where she goes to buy it herself, takes it, she could still go to see the doctor.
Okay.
Yes.
Okay. It's a good question. So for chronic conditions, we always advocate regular checkup. Diabetes.
So chronic means if it is severe.
Yes, something that is
prolonged.
long term.
Okay.
Asthma, diabetes is long term.
Oh, okay.
Yes.
So it's not like it's severe.
No, it's long
term.
It's long term. You might have that for years.
Manage.
Yeah, you've been managing it. That's what she's saying when she meant that she knows the condition, she knows the medication she takes. So why should she go?
Yes.
You see. So, but then there are instances where modification comes in. Like I mentioned, if it's you're hypertensive, your medication needs to be modified based on as you age. Maybe your BP range is now changing. Maybe if you were on some 4 to 5 antihypertensives, and now your BP range is getting so low, you might have to take some out. But if you don't have knowledge of that, you think you were put on this, so you have to be on this for life, then that would cause more problems for you.
Okay.
Now, in her case, it's good to always go for regular checkup, have a set time. And I mean, advanced world, you'd realize that there are groups, there are support groups for most chronic conditions. So diabetes, there's a support group.
So you find
there's a support group. Asthma, there's a support group. So you even have a WhatsApp page, you have a Telegram page where they keep you updated as to what to do, when to come, or your next review. So try to find support groups as well. Now the reason why she needs to go for those checkups is that sometimes you might have an acute exacerbation of asthma, which your normal salbutamol, the blue inhaler, might not help. Do you get it? So you feel like you are in distress. So but you have your salbutamol. Do you understand? So in that case, they'll have to put you on a steroid or something that would help you on a baseline for a period. If you're an athlete or you do some stressful activity, they'll tell you, okay, at this time, take it 30 minutes before you do this. If you have to run up the stairs, take it 30 minutes before you do this. So you need that regular checkup.
Okay.
And asthmatic medications are modified every now and then based on how your lung function presents.
I see. Abigail is on the line calling us from Shashi. Abigail, can you hear us? Good morning.
Yes, please. Good morning. Okay. This is my question to you. Please, I want to ask, because I've not experienced it. I want to ask whether having orgasm is a disease, because I don't even know how it feels. But when we are sitting among friends, they will be talking about, girls will be talking about it, and I feel empty, like, what are they talking about? And it has made me like, let me just lie down there and go. I don't enjoy it. So I want to ask whether it's a disease, so that I will start, because I'm a type that doesn't feel, by the grace of God, I don't normally sick. I don't go to hospital unless maybe I'm pregnant and maybe I'm going to give birth. Yeah, so please, it's really eating me up, and I can't expose it to anybody. So this program now, nobody knows me, so I'm asking.
So not having it is what you're asking, whether or not it's a problem.
Yes, I don't even know what it is when they are talking about
Okay.
orgasm. So I wanted to that is a disease.
Right. Okay. Thank you very much, Abigail. You don't get it?
I didn't hear what she said. I could barely hear.
So orgasm,
Okay.
she's not got knowledge of it because she's not experienced it before.
Okay.
She's always healthy, but she's not experienced it. But girls talk about it, and she has not. So that's the question. So she wants to know whether or not she's okay not having it.
Ah, I see. Oh, I think the Love Doctor series should have covered it. The Love Doctor series.
Unfortunately,
The Love Doctor series.
Abigail didn't ask
Oh,
us.
I know. I think this one goes more to the counselor professional aspect
right,
of
because
it.
it's got to do with the mind.
Yeah, so they should be in a good stance to answer a more social question like that.
There's no medical attachment to a medical implication, effect, or connotation, whatever it is.
Yeah, I think that if she has her female reproductive system intact, right, and then again, what are the friends saying? How can they explain it? What if she's experienced it, perhaps don't know what it is? So she needs counseling. She needs to be counseled by a professional, who has encountered a number of, marital issues or what have you, right? So it wouldn't be so bad. I'm sure we spoke about that during the Love Doctor series at a point.
We couldn't go because it's very sensitive and it's daytime. There's like more data. Anybody could chance on it.
Great.
And all of that.
Yeah, so I think she needs to get a counselor and speak into that because there's so many factors that could
I also believe that your friends might be very wrong channels of getting those understanding. How they are getting it. So I agree with you that it could be. So yeah, a counselor could work and all of that. So we're talking about the weakness of the immune system.
Yeah.
And we're talking about the signs.
Yeah, so I think I highlighted the fact that you have frequent infections, cold, catarrh, headache, fever, every now and then, diarrhea, general body weakness, and so on and so forth. So these could be pointers, that just get yourself checked and get some rest.
Stress comes with, of course, what just as you even mentioned, the issue of the mind.
Yeah.
You could be tired and you could be stressed from just thinking about it. There's also the issue of engaging in a lot of work.
Yeah.
There's something that's, I don't know, but I don't know whether you are the right person to ask. The sun and too much of it. So, okay, Gilbert is on the line before I come to that question. Gilbert, can you hear us?
Please, good morning.
Good morning.
As I said earlier, my name is Gilbert calling from Ablekuma.
Okay, great.
Please, I have this kind of problem and I just need some kind of advice. I don't know, I lost my job some few months ago. So I've been in the house for some few months. And I don't know whether I'm being depressed or is it anxiety or stress or whatsoever. I'm not able to sleep, bad dreams. I feel scared, like I'm scared of. I'm like, a doom is in front of me. I just can't see things clear and all that. So I just need advice on that. Whether I just don't know whether it's an emotional thing, a mental thing, or what, I don't know.
Right. Right. So while we are dealing with it here, hold the line. Let them pick your number as well, so we can also connect you to a counselor to deal with. But it's talking. You heard the question. So he lost a job. He's been in the house for 2 months. Okay. There are feelings of him being depressed and all of that, and so you can tell the fear and anxiety and all of that is characterizing his.
Yeah. So I think that. Like you said rightly, he needs, to be counseled. And it's not a one-day affair. He needs to be spoken through, these unfortunate situations, losing a loved one and all that. There are things that you don't go through in a day, right? Your mental health is at stake. And I always say that mental health needs more sunlight, more candor, more unashamed conversations. So it's a good thing that he's been able to speak up. And if we could get his contact, we connect him to a counselor. Because he needs, cognitive behavioral therapy, where he needs to be spoken to, right? Okay, what to do, the way forward, hope, You know, some people hold on to hope.
Yes.
Sometimes I always say that if you cannot give someone money, you cannot help someone financially, offer them hope. Because you could hold on to a strand of hope and then you'll be helped somewhere.
Yeah.
Right.
So Gilbert, as I shared today, make sure that Romans 4:21 helps you to understand that you yourself be persuaded that God has the power and has the ability to deal with whatever promises that He's been made. That's the hope we have in Christ Jesus, that He'll come through for us whether we like it or not. Now, what I know about this, once I'm alive, it means there's something about me today. So if I'm not dead yet, there's something. What is that thing? Let God speak to you. Let the Holy Spirit guide and help you. But let's connect you to a counselor to help you, even as we take a look at that as well. So we're talking about the sun, excessive sun. I see I can take long walks, you know, when it's not sunny. But when it's sunny, I get tired easily. Could it be that the sun also could be giving us a lot of stress? We don't know. I don't know.
So, something just came to mind to just tell Gilbert before we move on that he never promised that the road would be easy, you know, totally easy. But one thing he promised is that he will be with us every step of the way. So just know that whatever you're going through, God is there with you. And of course, this is the time where He needs your attention the most. You should be asking yourself, what is the reason why you're unemployed till now? What can you pick out of it? You know, get closer to God and let Him speak to you. You'd be amazed the ideas that He would, perhaps, you know, it's a disappointment that is setting you up for your next level. It's taking you from great mess to greatness. So you don't want to miss your greatness whilst in your great mess. So utilize your great mess and God will take you to greatness.
Indeed.
Amen.
Is there a caller on the line? Dominic, is it?
Hello?
Doris, yes. Doris,
Hello,
hi.
good morning.
Good morning, you're on air. Talk to us.
Yeah, my name is Joyce.
Doris, yes.
I'm calling from Bawi.
Bawi, right.
I want to ask the doctor. Sometimes I can't sleep. And if it happens for me to sleep, it's only once that I feel I have slept well today. But it takes a long time for me not to sleep well. I don't understand it.
I see. Okay. Sleep.
So when it comes to sleeping, you realize that, I mean, even some patients come to the hospital and they want to give them a sleeping tablet. Right. But we don't do that. We don't do that because we first off want to look out for the non-pharmacological causes of you not being able to sleep or insomnia in medical terms. Yes. And then would address the pharmacological, which is medication, which actually is for a short period of time. We don't give it for long term. But there are so many things that people do wrong that prevent them from sleeping. And one of the things we would advise to tell them is the fact that ensure that your bed space is only for sleeping. Right. So if you are not feeling sleepy, don't go there. Because some people get so used to lying in bed the whole day that now when it's night, they are not able to sleep.
Oh, I
so
see.
When you are up and about, don't use the bed.
Yeah.
Now, when you're about to go to sleep, try not to take coffee, some few hours before. Try not to engage in rigorous exercise right before going to bed. And when you are in bed, try not to use your device. Yeah. Some people tend to hold their phone, they are on Instagram.
You see, that's what makes them sleep, rather.
That's what makes them not sleep.
Right.
Because the screen is always on. The light is always on your eyes. So that prevents you from sleeping.
Take a book and read. It makes you sleep. I tell you for a fact. You might not understand it because you have long hours of reading. As for we, the general students, it is the book that makes us. I was told today that somebody took kinky at 2 a.m.
Whoa.
2 a.m. kinky. But it's fine. It's all right. It's all right.
Yeah.
So that's what doctor is saying. Please make sure you do these things. And let's see how it goes. Rhoda Dote says, good morning, doctor. Please, and it drops this on our YouTube live stream. Please, can constant having kidney stones lead to kidney failure? Lead to kidney failure? Yeah. That's a conversation. Yeah.
So you won't even have a kidney stone that long enough to get to kidney failure, trust me, because the pain can make you crawl. We describe as a pain that makes a grown, active man crawl on his knees.
Whoa.
So you can't have that, except of course it's a very tiny stone that is not causing pain. And with that, with hydration, taking water with time, gets to dissolve and get off. But if it's a pain, if it's a stone that causes pain, symptomatic, right? You can't even, but yeah, it can cause kidney problems, but you won't even get to that point. You will come to the hospital. If you are someone you've told yourself that you never visit the hospital, trust me, when you get a kidney stone, nobody tell you
to come to the hospital. I see. So we're talking about the sun. I think on that.
Yes. Yeah. So sunlight is good. It's good vitamin D. It's good vitamin D for the body. And with vitamin D, we need it for so many things. For calcium absorption and all that. And even for your vitamin D, it goes through a process where it hits the sunlight, it goes to the kidney for hydroxylation, and all that. So the body needs to utilize vitamin D so we can absorb calcium. So vitamin D is good. Now, we usually say that the early morning sun is good because it's not that, But then again, the negative side to prolonged exposure is that it could lead to certain skin cancers.
Okay.
Now, you realize that some people come with melanoma, skin lesions that have developed into a cancer because of, they are frequently exposed and then they have a genetic predisposition to that cancer. Now, sunlight sort of like triggers it out. So in that case, we don't want to advise, a number of unlimited access or exposure to sunlight, especially if you're doing a job that always constantly you have to be under the sun, and it's really, really not the best. Because you might not know if you have a genetic predisposition to these cancers. Most of these cancers, we don't know how it comes about. Right. One of the cancers that we know for a fact, this is the cause, is cervical cancer, HPV. So as a woman, you can decide that you would not get cervical cancer and you would not get it. But other cancers tend to come from a family, tree where your parents had it. Perhaps you were not aware, maybe they died of something else, and perhaps, that lingered, through you, to you, and then you don't know about it, but certain things just triggers it. One of them is skin cancer, right? So sunlight, sun exposure, prolonged sun exposure can trigger skin cancer. So it's not always good to have a prolonged, exposure to sunlight.
I see. Well, finally, before we let you go, tell us about so immune system. We know what to do now. Exercise, drink water, mind your business. Don't stress too much.
Sleep,
sleep and all of that. Exercise. It's not for the rich. Because I see them, they hang their things, they wear very. I see until I buy that is when I'll go. Because I don't have money to buy those leggings. They call it, it's not leggings, they call it. And hang the phone here. That's the only time I want to go.
Some people can actually dress up like that, but not say.
Settings. People are setting themselves in this country. So I can just wear my shorts and go.
They'll do and take videos for the gram. They'll take videos and pictures for the gram. After taking the videos and pictures, they'll remove it and put it.
No, my people. I'm wearing my shorts now and my camping shoes tomorrow and start. You can also do that. Short distances, take bricks walks and all of that. I think it will help all of us so that we can. Because I've not seen, one of the things, I've not seen very old men with large pot bellies live long. I want to start like huge people live so long.
Do a study on that.
Yeah. So
you will do that study.
No, it's not like mine has come like that. So it's coming, but it's not come like that. So I'm covering my. But of course, please do that. Of course, take the things doctor said seriously, so we can prolong our lives. We're grateful. Thank you very much for coming.
Yeah.
Dr. Wisdom Effiong is from arguably what is one of the best hospitals here in Africa, the Bank Hospital. And so wherever you are in the world, you can just go to their sites, or is there a number? The Bank Hospital everywhere, and connect with them. They could help you even from wherever you are across the continent or even outside the country. Very great doctors there. The best of the best are there. Well, there's something happening at the University of Ghana. We're told there's a fire coming up. When we come back from this break, we'll share these details with you. Stay with us.